Hey guys, and welcome back to my channel. If you already haven't, please subscribe to my channel. It would mean the world to me. And today I am currently here at my acupuncture location, and this is my acupuncturist, Kate. And a lot of people have been asking me like what benefits I've gotten from this and how it's changed my life and things like that. And I think a lot of people with disabilities don't really realize how beneficial this treatment is. So I figured it'd be awesome to do a video so you guys know that. So, and she was all on board with it, and she also knows that it's very beneficial. So I'm gonna let her go and talk about the professional side of all this and the science behind it more, because I can't do that. I'm not trained to. So without further ado, here's Kate.
Hi, I'm Kate Frame. I'm a licensed acupuncturist. I've been practicing for about 2.5 years. So in America, to become an acupuncturist, there's actually a lot more training than most people think. You have to get your bachelor's. You can get it in whatever you want. I personally got it in biology, but you have to take all of the Western science classes. So you have to take organic chemistry, biochemistry, anatomy, all that stuff before entering acupuncture school. Acupuncture school is a graduate program. It's 3.5 years, all year round. So it's the same length as a Western medical school program, 4 years, but kind of squished into 3.5 years. And during your last year, you do your internship, your clinicals, where you treat real patients, similar to a residency for medical school. So acupuncture is so great for almost any condition, and what acupuncture does on a basic level is any kind of pathology is due to a lack of blood circulation. So what acupuncture does is it brings the body back into balance, back into homeostasis. So it works specifically with the nervous system, and what it does is it allows the nervous system to release chemicals in the brain, the spinal cord, and in the muscles. And what that does is it can do a myriad of things, really. And someone a long time ago figured out there's probably about 300 to 400 acupuncture points that we stick the needles into, and every specific point has a different function. And someone found out that if you stick a needle in a specific point, it will do a very specific thing. And you know, the list of benefits are so numerous, but basically what it does is you stick a needle into a point and it can release endorphins. It can change the way the body reacts and experiences pain. It can release hormones, it can release chemicals. So we can affect the digestive system. We can release norepinephrine, serotonin, you name it, we can do it. That's why we can affect anxiety, we can affect sleep, mental emotional issues, pain, infertility, you name it, we can do it, because we're working with the central nervous system, which affects almost every part of the body. Another therapy we love to use is also cupping. So cupping is another thing we do on top of acupuncture. If you're familiar with the Olympics, you've seen Michael Phelps. He rocks those little octopus type circle marks, and that kind of got everyone, you know, excited about this new therapy called cupping, which has actually been around for thousands of years in Chinese medicine. And what cupping does, very similar to acupuncture, it increases blood circulation. So it's really good for musculoskeletal complaints, tension and pain, specifically of the neck and the back, but we can cup a lot of different areas. And it's so good for muscle pain and increasing the blood circulation to that area of the body. So, yeah.
Did you want to say anything about the needles?
A big thing about acupuncture is the needle. Everyone's so afraid of the needles. Our needles there's nothing in them, there's no medicine, they're just stainless steel.
I wouldn't even call them needles, I'd call them filaments.
Yes, they are filaments. And they are slightly thicker than a human hair. So the needle that you take blood with, I think you can fit about 35 to 45 of our needles in one single hypodermic needle that you would get blood taken out of. So I'll show you a needle here. You're right, I hate the word needle because it really isn't a needle.
Yeah.
So it's so very thin.
Now I don't know. Here, this is what you do. Here.
Show.
Yeah. So I'm gonna go ahead and zoom into this so you guys can see. It'll focus. See, you probably can't even see it because it's so small. Okay. It like moves like so easily.
People say for the most part acupuncture is relatively painless. You might feel a quick pinch when they go in. That's definitely not unheard of. Some people will feel absolutely nothing. It depends on the person. It depends on how sensitive they are. It depends on where we're putting them in the body. If there's a lot of flesh, if there's less flesh. The most you feel is a quick pinch, and once they're all in, you'll feel nothing. So it's way, for the most part, for most people, it's so much better than going to the Western doctor. All the different therapies you get done, blood taken, shots, nothing compared to that. I've never had a patient have an issue with the actual needles. Like I said, I don't like to say it's painless because sometimes you will feel a quick pinch. They are needles at the end of the day, but after they're in, it's usually for what, 10, 15, 20 seconds. If not, I'll adapt it.
And then they're also very superficially in you. They're not like deep in you.
Yes, they're very superficial. These needles are so thin, even if they were dug in, you can't really penetrate. You can't do any damage. You can't hit, if you hit a nerve, it won't even penetrate a nerve. Not that we ever do that. But you have to really, really try to do damage with an acupuncture needle. Only the people that do damage are people that aren't licensed or trained with the traditional acupuncture education. Because there are some PTs and other people doing acupuncture. So definitely check the training of the person you're getting done for, because you can do damage if you don't have the proper training. With the proper training, it's almost impossible.
Now, is it common in America that people are like practicing like without legit like schooling, and how can someone find the legit schooling and stuff like that?
So there are doctors that I think you have to get about 300 to 350 hours of training to practice acupuncture as a doctor. For the most part, I don't see any harm in that because doctors have so much training. They're well informed of anatomy. They rarely do any damage for the most part. I will say they sometimes aren't as effective because 300 hours versus 3 years, we have such intensive training. Personally, I would go to someone who has 3 years of training on how to insert needles and where to insert them versus a doctor. But if that's the only option, I 100% are okay with doctors practicing acupuncture. What is the big controversy is dry needling. That is when PTs or chiropractors are actually doing acupuncture, and they have a weekend course training with that, which is very scary. There's a lot of laws that acupuncturists and PTs are now fighting against dry needling. I'm okay with chiropractors and PTs needling, but I want them to get the proper training, and right now they're not getting the proper training, and that's where you hear all of the stories of acupuncture did this to me, acupuncture did that. I think 95% of them are physical therapists or chiropractors doing that damage, and they call it dry needling. Now, what I do is dry needling. It's a form of acupuncture. So I definitely do dry needling. I can do what you find in the physical therapist and chiropractic offices, but I would ask what kind of training they've done, if they've been to an acupuncture school, how many hours of acupuncture training they've done, aside from their anatomy and other courses they take. But dry needling is the big term that physical therapists and chiropractors will use, and I've seen a lot more harm than I've seen benefit. So just be careful and see who you are going to, and make sure they have the proper training.
See, how I found her was my brother, as I probably mentioned, is a chiropractor, and he kind of recommended like a last ditch effort, just try this, it can't hurt. And that's the biggest thing I stress people when I talk about this is like, what do you have to lose? It can't hurt. Like at this point, if you're that bad off, you're going to try anything to get out of pain. And I was like, all right, let's try it. So I live in the middle of nowhere, and I looked it up, I googled it, and there were ones like I saw the doctors and stuff who did it, and I was like, I don't know. And so I just like expanded the search to like 60 miles, because I'm like, well, I would drive an hour to see a doctor specialist, so why wouldn't I drive an hour to see like someone that could potentially help what I'm going through? So I put in 60 miles, and her name popped up, and apparently she treats a Pittsburgh Steeler, and he left like a comment, like I guess a review on Google, and that review was saying he was having muscle issues, and it kind of sounded like what I was having going on. And I'm like, well, listen, if this guy can beat his body up like all the time, there's no reason why he can't help me. Like, I'm not beating my body up as much as he is. Like, she should be able to help me if she's helping him. So that was, look at reviews too.
Yes.
And that's another thing, because like if you're not looking at reviews, you could be going somewhere scary too. Like that's my number one thing too. Like, look at reviews, and look at several reviews, not just like 3, because there are different review sites. That's another thing. There's lots of different reviews.
Yeah, and if there are no reviews, that these days is a red flag. Make sure there's some kind of feedback.
Yes.
For the practitioner.
Yeah, that definitely, like, that was what kind of sold me to drive an hour to see someone with the proper training and all that stuff. So it's been a good experience. I've been getting treated like what, since April, May?
Yeah, a few months here.
So I would say the first time I went in here like going, oh, this is a bunch of hoo-ha, it's not gonna help. and I was like, whatever, like I was frozen like this. I couldn't move, I was frozen up, and I'm like, this is crazy. And she told me after my first treatment that you're gonna experience these things. I let her go over that, and I was like, yeah, whatever. And everything she said was 100% legit about what I experienced. And like with one treatment, I was like from here to like here. And by a couple treatments later, I'm able to move. So I'll let her go over what it's like to have your first treatment and like the things you might experience with the first treatment.
Why don't you tell them first, what did you experience?
Okay, so
I'll give the spiel, but it might be a little bit different.
Okay, so my first thing, she told me that you're going to get like a acupuncture hangover type thing.
Okay.
And I felt very exhausted, and it was pretty much, she was saying that's how your body interprets relaxing. So I was very tired and I was very exhausted, and I did go home and sleep. So when you do your first treatment, I would recommend going home and sleeping if you can. And my body was just like craving protein for some reason, and normally I'm like, yeah, and it was craving all types of protein. And she did say, go home and listen to your body, do what it says. So I did go home and eat protein after my nap, and woke up and drank a lot of water too. I was very thirsty, and I'm not usually that thirsty, because with a spinal cord injury you kind of just learn to deal with your thirst and not drink, because you don't want to urinate yourself all the time. So I kind of was like, this is weird. So I did drink a lot more water that day, and I would say by the next day, like, I kind of was like from here to like here, and I was able to like move, because when I went in I was stiff, and if I tried to move it hurt so bad I was screaming. So and I didn't expect I was going to get instantaneous results like that. So
yeah, so that's spot on. So a lot of times I'll tell people, everyone's experience is very different. That's why I asked her to explain hers, because I don't want to say stuff necessarily that's different. But it really depends on the person. It depends on what they're coming in for, how long they've had the issue, how severe. I'd say about 70% of my patients will notice some kind of change with the first treatment. Usually 95% of the times it's a positive change, it's improvement. About 5% of my cases will actually feel worse. That is a great sign. Very, very rare, but that's your body fighting the treatment. You're reacting to what we're doing. Way better prognosis than coming back with no change. But some people, I'd say about 30 to 40% of my patients will take a few treatments to notice any kind of change. If you've had back pain an issue for 40 years, it's going to take a little bit to notice a shift. And then that fatigue, weird feeling after treatment, we call it acu-stoned. I don't know if anyone knows what it's like to feel stoned, but a lot of patients will literally feel high and super relaxed and super sleepy. Because what acupuncture does is it suppresses the sympathetic nervous system, that fight or flight mode, that adrenaline that most people are in when you're constantly tensed up. If you've been dealing with chronic pain, if you're not sleeping well, if you're stressed out, which is 95% of the population, I could argue 100%.
probably 100%.
Your sympathetic nervous system is up. You're running on adrenaline. And most people are exhausted. They're not eating well, they're not sleeping enough, they're stressed, but we don't feel it because we're just go, go, go mode. With acupuncture, we suppress that fight or flight, because that can also, cause a lot of damage to most of our symptoms. That's kind of the root of a lot of our issues. So we suppress that, and then you start to feel the exhaustion, and you start to feel the relaxation, which is a positive thing. That's why I tell people, listen to your body. If you need that protein, if you need all that water, but you haven't been drinking it, and you haven't really been craving it because your body's so focused on, we're so stressed, we're high alert, we don't have to worry about the protein, we can't worry about the water, we're just trying to live day by day. We're in survive mode here. And we can't listen to our body, and then all these symptoms start to develop before we even realize it. So that's why I tell people, listen to your body. I had a patient who was in chronic pain for 35 years. She went and slept for 8 hours. Wow. She had a morning appointment. She slept all day, woke up feeling like a brand new person, because she's been dealing with so much for so long. So it's kind of like a reset to the system. And that's why some people will leave here and they won't feel anything super dramatic, because maybe their system wasn't that out of balance. It's just so variable and so dependent. But yeah.
Now, do you think people need to continue treatment forever, or do you think it's if they can't afford or whatever, they can go and whatever problem is affecting them then get that taken care of and then come back? Or how do you recommend treatment things to be?
Sure. So that's also a big variable. A lot of my patients, if I can get you in and out the door, I want you out as soon as possible. So, you know, if you have a acute issue, something that's been going on for a few months, even a few years, I've had chronic people with this case too. Usually I recommend once to twice a week for the first few weeks, depending on how severe you are. Once we get you to a pretty good place, I've had people be released after 4, 6, 8 treatments. And that's about 30-40% of my clientele. The other 60-70% are chronic patients. They either have severe arthritis, they have severe, you know, fibromyalgia. I have cancer patients. I have patients that have issues that will never really fully go away.
Spinal cord injuries.
Right, or are constantly aggravated by everyday life. You know, a lot of my anxiety stress patients do great, but let's be real, who doesn't have a constant influx of stress coming in? So at that point, I always give it up to my patients. I say, hey, once we're at a stable point, whether you're 100%, 80%, 60%, wherever you're at, wherever we kind of hit that plateau, if we do, or if you're fully healed. I have a lot of people that come in for about monthly maintenance. I have some people that come in every 3 months, some people that come in every 2 to 3 weeks. That we try to find the most time and most space in between treatments we can give you that you maintain those results. And then we see you at that stage. And then I have a few people that choose, hey, I'm 90%, I'm totally fine. I'll give you a call if I have any issues, if anything kind of comes back. And I give people that option. Now for some of my patients, fibromyalgia patients, I tell them they would probably benefit from regular month to every 3 month treatments, or their symptoms may relapse. And I always say, if you want to give it a shot, maybe they won't. I had a fibromyalgia patient come in after a year. She did great, and then after about a year, she started to notice things get out of whack. So that's fair too. At the end of the day, it is up to the patient. And I don't recommend, yes, in a perfect world, everyone would get maintenance. You can always work on something with acupuncture. Even if you say you have no issues, I guarantee you have some kind of thing that you can do better. You can always feel better. So in a perfect world, everyone would get maintenance. I try to give people the least amount of responsibility because it is out of pocket, money, time. You know, I want to give people what I least recommend so that they can, you know, take it with what they will. So
now a lot of people ask me, does insurance cover anything? And talk about that.
Yeah. So for the most part, insurance is an uphill battle. For the most part, insurance does not cover acupuncture. There's a few, I think Blue Cross Blue Shield, and I can't think of the other one, that do for, UPMC does for only 4 specific issues. It's back pain, headaches, knee pain, and chemo-induced nausea, if I remember correctly. I personally do not deal with insurance. There are some acupuncturists that do. Most of them are in the city, in Pittsburgh, and then who knows, wherever you're located. But what a lot of acupuncturists will do is they'll give you a super bill, and then you can go and submit that to your insurance if we don't personally do insurance billing. I do have a few people that go that route. And then also if you have any kind of auto accident or workman's comp, I personally work with both of those, and a lot of acupuncturists do. It's a lot easier to get in there than with the insurance companies. So it's definitely a lot of, you know, people from car accidents will go to a chiropractor or a physical therapist, which is great, but they don't know that acupuncture is covered. And they can definitely get treatment there, so that's definitely another option. But for the most part, acupuncture is out of pocket for most of my patients. I mean, some people, we do get full resolution all the time. It just it depends on the issue. Some people expect miracles, and acupuncture, as cool as it is, it's not magic. It's scientific, it's medicine, it's healing, and we're trying to let your body heal itself to the best of its abilities. If you have a broken bone, we can speed that process up. We can't heal a broken bone. If you have severe degeneration, you have bone on bone, we can't rebuild cartilage. We can only do what your body's capable of doing, which can be a lot to help you, you know, live a better quality of life. And a lot of cases, we can get you to 90 to 100%. Some cases we just can't, you know, because this is healing. At the end of the day, people sometimes walk in expecting miracles, and I have seen miracles happen. You know, I had one patient with severe, he had 4 surgeries on his shoulder and his neck. He was in 9 out of 10 pain constantly. He went to several other acupuncturists, chiropractors. You know, he had his whole neck fused, horrible pain. I told him 20 treatments. You know, this is going to take a long time. 1 treatment, out of pain. I saw him 2 years after that, and he's still out of pain. He came in for something else. That does happen, not frequently. And I bet that his pain was already gone but he was having a mental emotional connection with the pain, because we can't rid the body of that severe pain in one treatment, and maybe not ever. So I always like to emphasize that yes, acupuncture is magical and it can be so healing, but at the end of the day, it's healing. It's real scientific medicine. You know,
it won't heal my spinal cord injury.
No, it will not.
It will not heal it. It'll just make my body deal with it a little bit better than it was,
which can be huge.
Yeah, it's changed my life. Yeah, my quality of life has been completely better since I've been coming, and I'm very grateful for my brother for helping me fund me to come and do this, and for recommending me to do this and knowing about it. So I definitely would recommend it to anyone who has a spinal cord injury, who may be in severe pain, and you think that you can't see a chiropractor, you can't do this stuff, and your only option is pain medicine, your only option is this, like, and you just feel like you're in a pit of despair, because I've been there, or your spasms or whatever is so bad, and like I said, you have nothing left to lose at that point. Why not try it? It's worth the opportunity to try it. So I definitely recommend it to anyone who has my type of injury, or any type of spinal cord injury patient, or anyone, and for that matter, but since people are watching this for spinal cord injury stuff, I definitely would say it's a very good treatment.
Right, and no matter where you have the issue, we don't necessarily have to put needles where you have the pain or the issue. I don't care if you can get on the table, if you can't get on the table. You know, if your issue is in a very sensitive area, I don't have to put needles, and a lot of times I don't. It depends on the patient. But it doesn't matter what. I've had people come in for groin issues, you know, testicular pain, stuff like that. I don't put needles near sensitive areas, and I can treat you even if I can't access the area of their body that's bothering you. So that's a big misconception with acupuncture.
And as you can see, she's sitting on a table when you did mention that. I personally don't transfer onto the table. I do the treatment in my chair because it's just easier and we make it work. So if you can't transfer, and that's a concern of yours, you can be treated in your chair still. And like she said, like, I know, like, where my surgery scar is, it is very sensitive and stuff. She's not putting any of the needles anywhere near that. She doesn't take the cup over that area. She keeps away from that sensitive area, like she said. And I mean, she gets things done by putting needles in my ear somehow. So you know, it's definitely, it is scary whenever you're like, oh, needles in my back, that's broken, and you know, I get it, because you're thinking needles like that IV needles, and it's not needles. So
yeah, we will work with you. Most acupuncturists will work with you. I think about 10% of my patients I treat in chairs or recliners, and most acupuncturists work like that. So you always ask, they will accommodate you, and they don't ever have to go near your issue if that's, you know, a problem for you.